How many times have you asked a question in a role play or a consultation and you get a much longer answer than you were expecting or than you were hoping for? This is going to talk a little about how to try and prevent that occurring, and therefore how to try and save or to have better time management when it comes to data gathering. I'm Dr. Arora from Arora Medical Education, and we do lots of teaching around consultations and things like plab 2 and RCA and many other medical exams that you might be preparing for. So let's talk about that type of typical scenario. Okay, so you ask a patient, so maybe someone comes in with, I don't know, change in bowel habit, and you want to go through a couple of red flag questions, and we all know about signposting, we all know about explaining why these questions need to happen. We all know about open and closed questions. So open questions expecting more of an answer, closed questions expecting a short answer. But sometimes still it doesn't work. You say to a patient, this is X, when it comes to changes in bowel habit, I'm going to ask you a few, there's a couple of medical questions that I need to ask, just going to run through a few. So you set it up really well, you signpost it really well, and you ask closed questions. Have you had any weight loss? But you get a really long answer. Well, doctor, I'm not sure. I think I might have lost a bit of weight. I went to the gym last year and I signed up and I started going twice a year. I think I lost a bit, but then maybe I got a bit lax and I think my weight's gone up again, doctor, so I'm not really sure. And you're thinking like, come on, I just want to know, have you lost weight or not? You may say to somebody, have you lost your appetite? And they're like, well, I don't know. I tried to deliberately cut down my eating, but then actually last year I probably went through a bad phase, started to eat a bit more, and now I'm trying to say things again. You just want to know, have you lost appetite? So what we talk a lot about in role plays and consultations for things like plab 2, RCA, and medical school finals and things, is to try and set the expectation of the type of answer that you want. So it goes a little bit beyond signposting. So you might say to somebody, Mrs. X, when it comes to change in bowel habit, there are a couple of medical questions that we tend to ask. So just a couple of yes/no questions, if that's okay. Just a few things are okay. So do you notice how I said just a couple of yes/no questions? So I'm setting the expectation as to what type of answer I want in return. So I'm looking for a yes/no answer. This is slightly more than just asking a closed question. This is slightly more than just signposting. This is setting the expectation of the type of answer that you want. Now, of course, you're talking to another human being, so you can't guarantee that you're going to get a yes or no. But what you're doing is you're doing everything in your power to try and ensure that the person gives you a simple yes or no, so you can get through your list of red flags, tick them off, and then move on to your next set of questioning. Because so many times when I do role plays and see practice and see people doing things like plab 2 and RCA prep, the amount of time that they spent doing red flags, despite doing a signpost, despite doing closed questions, is still significant. And that time, as you know, is precious and can be used on the other side of the consultation in management. So for example, if you're doing the appetite question, Mrs. X, when it comes to changes in bowel habit, there are a couple of yes/no questions that we tend to ask just to check things are okay from a medical side point of view. Can I check, is your appetite okay? Now, I'm much more likely to get a yes or no if I've said that I'm looking for a yes or no answer than if I just say, how's your appetite, or has your appetite changed, where the likelihood of getting a much longer answer before you actually get the information that you're looking for is much more apparent. I really hope this helps. Much more consultation type still questions and videos and help and support on the channel. So please do subscribe, share, comment. If you're watching this on YouTube, if you're looking for any of our courses, please do use the coupon Arora Video 10 for 10% off any online course, audio course, mock exam, face-to-face session, live session, flashcards, whatever it is that you're looking for all the exams that you're doing, whether it be things like plab 2 or RCA or MSRA or GP training entry exams or medical school or anything else that you're doing at this particular point. I really hope they've been of some value. Please remember, don't just signpost, don't just use closed questions for red flags, but try and set the expectation of the type of answer that you're looking, and hopefully that can save you time in data gathering. I'm Dr. Arora from Arora Medical Education. Have a great day. #CampPassWillPass. #I went with Arora. Take care.